Hello, ma'am. It's so nice to meet you
Hello,
finally.
Rushil. How are you and how are you feeling? Firstly, let me introduce you. This is Dr. Rushil Shrivastava, and he is the recent FMG exam giver. And tell us about yourself, tell us your score, just whatever you want to speak.
So I scored, this was my first attempt and I scored 210 marks.
That's
And
great.
it's been quite a journey. And I just want to thank all of you. We have worked so hard with us, and I really am filled with gratitude to every faculty.
No, no, that's extremely great. We are very, very proud of you, Rushil. And just, it's just a general interview. I just want to know what were you doing when the exam result came out and how are you feeling? How are your family feeling? How is the feeling in general?
I was actually just in my room watching some Netflix because I was just trying to get off the stress of the whole exam
Yeah.
preparation, and suddenly all the groups started flooding with messages and everything. And I was so scared to check my roll number, and I was typing one digit at a time, hands are shaking. And finally, when I saw that, yeah, I have done it with 200 plus marks, so that was like a big sense of fulfillment.
Extreme. How is the family feeling? How are your parents
They are
feeling?
very, very happy.
Happy, extremely. I'm sure they are. So, just a few things generally. We all want to know, like, obviously, people who are going to be seeing this interview want to know that how did you prepare for it? What was your strategy? And, like, what I would say, what is the weightage you were giving? Were you giving it more to certain subjects, or, how was it for you?
I had some subjects which I know were a strong suit of mine. For example, surgery and allied subjects. So, surgery, radiology, OBGYN, these subjects I was very well versed with due to my university studies and everything. But there were certain subjects that I was kind of not good at. For example, biochemistry,
Hmm.
even microbiology was not a very strong suit for
Oh,
me,
I
and
agree. Okay.
ophthalmology. So
Hmm.
my goal was to give these subjects a lot more time to work on them to at least get about a 70% mark range in that in
Hmm.
GTs. That
Hmm.
is what I was aiming for, not to be like absolute perfect in all subjects, but to have like a decent knowledge about every subject to make
Hmm.
my case like a strong thing in the exam. And that helped me a lot.
Great. So were you like a mission subscriber? Were you just like a PYQ person or a GT person? Like, people have different strategies. So what did you
So
follow?
I very religiously followed mission classes. I have seen all
Mhm.
lectures live, no matter what was there.
Mhm.
And for GTs, I would really like to credit the whole Cerebellum app and team, because GTs are one thing which train you to not be faced by four or five questions which you know that you have no clue about. So
Yeah.
once you see them in exam and you change your whole mindset, that is where you tend to mess up a lot of things.
Yes.
So luckily, I have given all the GTs that were part of Cerebellum mission
Mhm.
program. So
Mhm.
at least 15 GTs I have covered till in
That's
my
great.
preparation. And I was just monitoring my weak subjects, that how am I able to do this in context of real exam, because you
Mhm.
never know which question is gonna come next.
That's true. And what about the E&Ds? Were you also giving E&Ds after each class? Like how was?
Yes, late night MCQs and E&Ds were a big part of preparation as well, because you know where you stand among your peers.
Yeah.
Also, to see, because my goal was since the beginning to score at least 200 marks.
You got
And
that. You got much more than 200. So that's great.
so that I set that thing in my mind as a personal expectation. Even Anand Bhatia sir in between our classes told us to write a number which you expect you will get, manifest
Hmm.
it, and you will get. I want
What
to
did
show
you
you,
manifest?
like, this my notes app. I wrote I
Oh
will
my
get 210
God,
marks.
that is so great. So you manifested it. You clearly manifested it. I mean, that's so amazing.
So yeah, it all worked out fine for me.
Yeah. So, okay. So how many hours did you actually give to studying? Because, as medicos, we are always taught कि 10 घंटा, 12 घंटा, 18 घंटा पढ़ोगे तभी कुछ हो पाएगा or something. So did you have the same strategy or did you have anything
I'm
different?
actually a very lazy person in that sense, because I do things when it is absolute necessity to do. It's not a healthy thing, but I used to wake up around 10 11,
Hmm.
and I used to go to the gym, do all the things
Hmm.
as part of keeping myself healthy.
That's
Uh,
also, if you go to the gym, you keep yourself healthy, even your mental state is healthy. It has
yes.
all those good hormones that we keep studying about. So that's great.
So, and then I gave at least 4 to 5 hours between our classes and
Hmm.
between my gym and the classes every day. And I used to give 2 hours after the class. So that was a 7 hours, but it was very consistent throughout my
Hmm.
preparation
Hmm.
phase.
Hmm.
So I used to revise only the things which we covered on that day,
Hmm.
and that pretty much worked well for me.
Hmm. So it wasn't like that you were doing like this mission classes where you have like 5 days or 7 days of one subject. So in that five,
Mhm.
7 days, you were just doing that subject. It wasn't like
Yes.
that you were like maybe doing something else. Because I do have a lot of students who say कि ma'am medicine class इतना लंबा चलता है, it goes till 2. Then when do I have the time to revise other subjects? So what was your thing?
For me personally, I find medicine very interesting.
Hmm.
And rather than being overwhelmed, you just realize how much you do not know yet.
Yeah. There's so much
So,
you still don't know. That's yes.
I
True.
mean, like Dilip sir is so knowledgeable and such a
True.
great clinician that he does not aim to teach you for the exam. He teaches you to become a good clinician,
That's
which
true.
is like a very underrated thing. He's not appreciated for very much.
Oh, no,
So
I'm
I
sure
really thank him
everybody
from this.
appreciates Dilip sir and the amount of efforts he puts. Like he sits at 2 in the morning and he'll be teaching with full
Yes.
enthusiasm. Hats off to him for doing that.
Even microbiology lab 2 and lab 3 were the ones that, gave me a bit of confidence. And because microbiology used to be my weakest subject, I'm not
Yeah.
gonna,
So
but
I've heard from a lot of people. Yeah.
yeah, it gave me a sense of confidence. And when you see and do a lot of questions, you mess up a lot in GTs and everything.
Mm.
That hardwires those concepts into your head.
Yeah, that's great. So another thing that it's FMG is like such a long journey. You tend to study for so many years, a year or whatever. So you tend to have a lot of setbacks, self-doubt, you go through so much, some family problems, so many things. So is there something that you faced, and then if you did, then how did you come out from it?
Well, already my graduation was from Ukraine, so it was not a very easy place to live in.
Yeah, yeah.
At that time, I
Great.
was working in polytrauma department. I was seeing patients from battlefields all the time, so
Oh,
it was already mentally very taxing.
yeah.
But on a positive side, I got to work in surgery department. I assisted more than 1,000 cases during my
That's so great. I mean,
under.
not great in that sense, but like great as a doctor, yes, probably.
But yeah, coming back from it, it was always very mentally taxing to think about how things would be there when I have
Yeah,
left all of them there.
yeah, yeah.
So it was like a unsaid struggle of being
Mm.
in a place where it's not as comfortable as we are here.
Yeah, that is true. So, okay, great. So, last thing, because a lot of your juniors are going to be giving the exam, and also, is there any 3 points? If you had to give them three, points that they should be following, or like 3 tips for their
Mhm.
future, what would it be?
The first thing that I would say is don't change your plan. Stick to what you manifested before. Don't skip any subjects. Don't
Hmm.
say that I will do this later. Just do it now. Face the pain right now, and
Hmm.
you will not waste another 6 months of your life doing this. Second
That's
point would be do all GTs because
hmm.
during GTs, first few GTs are going to be very painful because
Yeah.
you will
It's
get
very
bad
disheartening.
marks. It will
Yeah,
hurt you mentally, but
yeah.
you need to push through it. For me personally, what happened during my real exam was that I started first set of 50 questions and I finished it in the whole grand test mentality. And I saw
Hmm.
that there is still 30 minutes left in my clock. And I really thought that I messed up big time because am
How
I
did I
doing it
finish
too
so
quick?
early?
Other people besides me are still on question 15 and I
Yeah,
have completed it all.
yeah,
So, but it just gives you the training and resilience to sit through it, sit through the 4.5 hour exam and not be taxed so much mentally. So GTs
yeah.
is a big part of preparation.
That's right.
Plus reviewing them is a very key factor because
Hmm.
some questions were directly from GT, some
Hmm.
concepts were directly from GT, and you got to correlate it mentally.
Great.
More you do it, the more
Then it gets
chances of
easier.
repeating.
As you keep going, it just gets easier. And GTs are anyway made. much more tougher than we make
Yes,
it a
exactly.
normal E&D. So I remember people used to come and say कि मैम E&D तो ये आसान होता है, but ये GTs इतने tough क्यों होते हैं?
That
So
is true.
it's made in a way so for you to prepare you guys for the exam, that no matter what comes, you will not get scared कि what has happened. So it's just a way to prepare you guys for the exam only.
My last tip would be to give yourself some space as well, personally. Don't
That's true.
lose all your personal life. This is
That's a
one
great
exam,
tip.
and set your goals high. If you set
Mhm.
to achieve 250, you will achieve 200. So
Yeah.
passing it's not just like
Yeah.
get 150. You have
Mhm.
to be a good clinician. Remember what you worked for all these years in NEET, UG, all
Yeah.
these 6 years, and it will all pay off eventually.
Great, great. That is a great tip. So thank you, Dr. Rushil. If there's anything else that you want to, give from your
I
side,
just
go ahead.
want to thank you. I just
No,
want to
no,
express my gratitude towards
no,
all
no, no
teachers. I can't
gratitude
do it enough.
required. Just really, really happy for all my students, and I'm hoping that you guys I will be seeing in the next NEET and INSCT
Yes,
preparation also,
exactly.
that
That
you
is
will
our
be
next
joining
target
back.
for sure.
Great, great, great. Thank you, Dr. Rushil, and see you soon.
Yes, ma'am. See you in Cerebellum.
So, yes, yes, definitely come to the cerebellum event.
Yes.
Definitely see you there.
Have a
Okay.
nice day, ma'am.
Have a nice day. Bye bye.